child has a reaction, would there be a medical exemption for the second child?
So the medical exemption,
Does it clearly
yes,
allow that?
So what the law, the bill and the law clearly states is that the medical exemption is at the professional judgment of the physician. We took an amendment to absolutely clarify that point. And so what that means is that if the physician feels that a sibling of a child, because the condition may be genetic, it may be family related, that therefore that child is also at increased risk, even though that child has not yet suffered harm, then they can exercise their professional judgment to provide an exemption. That is, it's the professional judgment of the physician in terms of what they believe that if the risk of the immunization is going to be such that it's going to put that child at certain or near, basically at increased harm, then they can provide that exemption. And so that's to the judgment of of actually any licensed physician in the state of California. There's no requirement that you even have to go to a physician that you've seen multiple times in the past. The law clearly states that any licensed physician in the state of California can provide a medical exemption. Mainly, what they have to do is document the reason. They document the duration, there's no limitation, that could be indefinite, and they have to sign it, of course, saying that they're as a licensed physician. Then you get a medical exemption.
Genetic predisposition or adverse reaction to a sibling or family member to be placed in, it would at least offer me a certain comfort of mind knowing that a need is being addressed.
Right. And I would reply.
It's not the belief.
Right. And what I would reply is that we leave wide discretion to the physician. Even the opponents have stated that that people have not identified that the genetic association with vaccine, vaccine problems. That there's a genetic, they can point to a particular gene or something that they said there needs to be more work on that. I think people are working very hard to be sure we keep our vaccines very safe, and they are. But that is something that a physician can exercise at discretion. As I said, it's not just what happened at one child. We take account of family history, that includes genetics and other types of things, in making a decision and weighing that against what's the risk to that patient. And we work with parents. That's what doctors do. I certainly appreciate Dr. Gordon does that, Dr. Blumberg does that, I do that, other physicians as well. And that's what's going to happen, and that's going to create. I think that basically addresses the issue that you're talking about, because if doctors aren't going to work with their patients, we have a whole different set of problems.
Would use their clinical judgment, and basically how we look at complaints. So we have to get a complaint to actually look at a case. So we don't track medical exemptions. We would have to receive a complaint in, and what we would do when we get that complaint is we would have another physician look at that and see, was the doctor acting within the standard of care? And so they would take into account, they would look at that patient's medical records, including family history, and the doctor would opine on that, on the decision that other physician made. And so I'm not a doctor, but as Dr. Pan said, it's safe to assume that all that family history and everything would be considered.
Thank you. Okay, we're going to move on. We're going to go to public comment, and I'm first going to...
If a physician feels that there's a genetic association, a sibling, a cousin, some other relative, it's not safe for vaccine, they can provide a medical exemption for that vaccine. There's no limitation on the physician from doing that other than their own professional judgment, their own knowledge and expertise about what they believe is safe for the patient. I think that when we craft our laws, it's best that we try not to direct unless we have strong scientific evidence, and we believe that direct the physician that they now must do something that they have the ability to already do. So I appreciate what you're saying. I also want to just reassure you, there is nothing in the bill or the existing law, and I would ask you to point it out if you feel there is, because then yes, I would be willing to look at an amendment that actually prevents the physician from doing exactly what you're asking them to do.
This will be my last comment, but Senator Pan, all due respect, there are 3 doctors sitting at the desk and you're not all agreeing. And that's what gives me some concern.
So
Now, naturally, not everyone needs, there shouldn't be 100% agreement, but this is a very, at some point, critical issue that I think we're intervening between a parent and a child. And if there is documented, if there is a sibling, or if there's family relationship, or if there's genetic potential opportunity for there to be something else happening, I would feel more comfortable.
Okay. So let me just say that actually, we've worked with the health committee staff. We've worked with the chair on this very, very specific issue. All right, there are some assertions that people have made that they think doctors won't do things or will do things or something. But we are dealing with a bill and the law, right? We're dealing with what the law says and what the bill will say, what physicians and parents can or cannot do at schools. And so what this bill has been crafted, working with the chair and the staff, looking at what the bill actually says, not what people would like to assert it says, what it actually says, how it will be interpreted. We have left that discretion to licensed physicians in the state of California, including whether it's your own physician, the specialist you're seeing, another physician. We have left that discretion open. Physicians, there's no limitation in the law. We've just heard from the medical board. We are not aware of any physician who's been disciplined, investigated because they provided a medical exemption. So there's no cloud hanging over them to be able to do this. Certainly they have to look at their own expertise and conscience and knowledge and be sure that they're fulfilling their oath to do the best they can for their patients. That is what we expect of our licensed physicians. But there's no legal barrier if they believe that a sibling, another, that needs to have an exemption, that they cannot grant that exemption. There's no legal barrier at all. So no matter what we put into the law, unless we want to force physicians and say you must, that's a whole different discussion.